name is Lacey Scully, and I'm an ADN student here at Wilson State College, and today I will be demonstrating various IV skills for my checkoff this week. First thing I'm going to do is verify my healthcare provider's orders for my patient Shirley Coase. So Dr. Catheter has ordered us to insert an IV and administer lactated ringers at 150 milliliters per hour. I know this is clinically indicated because my patient has severe dehydration and the fluids will help. So after verifying my orders for my patient, I'm going to go into the med room and perform hand hygiene and gather my supplies and the lactated ringers. So here I'm going to do my first med check. So I have lactated ringers, and all my other supplies that I need to insert my catheter IV. So now I'm going to go into my patient's room, not perform hand hygiene once again, and provide privacy since we will be doing a procedure, and introduce myself. Hi Shirley, my name is Lacey. I'm going to be your student nurse today. Can I get you to verify your name and date of birth for me? Shirley Coase, 4/3/1987. And do you have an allergy to codeine? Okay, perfect. That's what I have on my records, and that's what your allergy band says. So your doctor, due to your dehydration, has ordered us to insert an IV. That way we can get some fluids going in you and help with that, okay? So that's what I'm here to do. Do you have any questions for me before we begin? You don't? You've had an IV before? Okay, perfect. Well, I'm just going to get my stuff set up. You can just hang out and relax, and then we will get going, okay? So now, in the patient's room, I'm going to perform my second med check. So I have lactated ringers, and I'm going to take it out of the bag. My bag was not tampered with. I'm going to give my solution bag a few squeezes just to see if there's any holes, and there's not. I'm going to check the expiration date. It is not expired. My solution is clear, it's not cloudy, and there's no discoloration, so I know this is safe to give to my patient. So now that I have verified my solution and made sure it is safe, I'm going to get my primary tubing ready to go. So again, packaging is not tampered with, not expired. I'm going to open tubing, and the first thing I need to do is spike my bag. So I'm going to remove this cap, and spike my bag. So before I hang it up, I'm just going to make sure my cassette is closed, and it is. And hang my IV solution. Okay. Perfect. So there is this cap on the end, which is keeping this part of the tubing sterile. For this part, I'm going to take it off so I can prime my tubing, but I'm going to set it on the table with the opening facing up, so that way I'm not contaminating it, and I can put it back on. I'm going to squeeze this until it's halfway full, and then with my cassette inverted, I'm going to open, everything's open the cassette. Okay. Invert it, and it is dripping, so that way I know it's primed. I'm going to close my cassette at this point and just look over my tubing to make sure there's any air bubbles, and there is not. So carefully, I'm going to place this cap back on. That way it remains sterile until I'm ready to connect it to my patient. So I'm just going to hang it up here and move on to the next step in preparing this IV. So next thing I'm going to do is prime my saline lock. So I have my saline lock here. I'm going to open it. Open my normal saline flush. Remove this cap. Pull back to release the pressure, and then re-prime it and get any air bubbles out. Okay, I'm going to attach it here. Remove this cap, again making sure it stays sterile, and flush it. Perfect. And then there's no bubbles in the line. So I'm going to place this cap back on and place it in this packaging and set it over here, so that way it's easy access. So when I get ready to place my IV in my patient. The next thing I'm going to do is get my IV start kit. For the purpose of this video, it is open, but normally it would not be tampered with. I'm gonna open it and get all my supplies out. Okay, Shirley, we're gonna get this IV going, so I'm just gonna put this tourniquet up the top of your arm so we can pick out a vein, okay? Okay. Place it there. I'm just gonna palpate your forearm here. And I think this is a really good vein, so I think we're gonna use this vein right here, okay? Remove the tourniquet while I get all my other stuff ready. Going to clean my patient's arm in the side I've selected for 15 to 30 seconds. Okay, while that's drying, I have my tape prepared so I can easily get it and secure my catheter. Okay, Shirley, so I just wanted to go over this catheter with you real fast. So you will feel a stick because there is a needle inside, which helps us pierce the skin. But if you can see, there's this little white part. It's like a straw. That's the catheter itself. That is what will be left in your arm. After I have the IV placed, I will place the safety on, and that will retract the needle completely, and we'll throw that away. And so it'll just be this little straw like thing in your arm, okay? Do you have any questions for me before we get going? No? Okay. Well, we are going to go ahead and get this IV in our patient then. So I'm going to put the tourniquet and put my gloves on first. Okay, now that I have gloves on, Shirley, we're going to get our tourniquet on, okay? Okay. Open our catheter. We selected a 20 gauge catheter today for Shirley. Take the cap off. Okay, bevel is up. We're going to pull the skin back to secure it. Place it. I see flashback of blood. For the video, I'm going to go all the way in. Secure the catheter. Place my safety. Occlude this vein. Remove my tourniquet. And then I'm going to take off this. This will go in the sharps container. I'm going to take off this cap. Attach it to my catheter. Okay, Shirley, you're just going to feel. We're just going to check the patency of this IV, okay? Okay, did you feel any pain or anything? No? Okay, perfect. Well, I don't see any swelling or redness, so that is good. That's what we like to see. So the IV is patent. I'm just going to secure this. That way it's not moving and causing discomfort to my patient. We're going to leave that attached for now. Okay. Then I'm going to get my occlusive dressing. This is just going to make sure that your site's not getting infected, okay? Perfect. Okay. Once that's done, I am going to get these IV fluids hooked up shortly. So since both of these have remained sterile, I'm going to take this cap off. Take this cap off and connect them. Okay, so at this point I would set my pump to the correct 150 milliliters per hour, get that all going, and then after I get that going, I'm going to label everything. So I'm going to, this is for the IV solution bag, I'm just going to verify that I have the correct sticker for the correct patient. I'm going to date it so that way it goes past that 24-hour mark. The next nurse knows to switch the solution. place that on the back of the bag. Also going to label my IV tubing. So after 72 hours, it can be changed by the next nurse or per facility policy. Okay, and then I'm also going to label the IV site, so that way the next oncoming nurse knows when this particular IV was placed in the patient. Just gonna put that right over the dressing, but where they can still assess the IV itself. Okay, so this will go in the sharps container. I just don't have one for the video. So now it is later that day. The patient is no longer dehydrated, and my doctor has ordered us to discontinue the IV fluids. So I'm just going to verify my healthcare provider's orders. My patient Shirley Cost, discontinue IV fluids and a saline flush. So I just need a saline flush for this particular skill. So go knock, perform hand hygiene. I would get new gloves, and I am going to explain the patient. Shirley, can I have you verify your name and date of birth for me? Shirley Cost, 4/3/1987. And you have your allergy ban on for codeine, and that's what's on my records. So due to you not being dehydrated anymore, the doctor believes that we can discontinue the IV solution. So that's what I'm here to do, okay? Do you have any questions for me? No? Okay. Oh, and okay, so I am going to get my saline flush. Oh, I'm just gonna grab a new one since that dropped on the ground. Okay, again, pull back to release the tension, and then prime it. And there is a little air bubble on the bottom, so I'm just gonna flick it to get it out. Okay, so this was sterile, so I'm just gonna unstop the pump, of course. Going to disconnect this. So all this is doing, Shirley, is making sure that the IV is still viable. That way, if you were to need to get IV fluids again or medication IV, you already have a line and we don't have to poke you again later on, okay? Okay, so let me know if you feel any pain or anything, okay? No pain, okay? There's no redness, there's no swelling, so that is good. Perfect. So I'm just going to disconnect this saline lock and just leave this here for taped up on the patient's arm, just in case we were to need it again. And now it is later that day or the next morning, and the doctor has ordered us to discontinue the saline lock because Shirley gets to go home. So again, I would enter the room, knock, provide privacy, perform hand hygiene, put on new gloves, and discontinue this saline lock. So Shirley, can I have you verify your name and date of birth? Shirley Cost, 4/3/1987. Perfect. And you still have codeine allergy, correct? Perfect. That's what I have. So the doctor thinks you're ready to go home, so that's really exciting. You get to go home. So in order to go home, we got to discontinue the saline lock for you, okay? Okay, so for this, I just need my gauze and a piece of tape, which I already have prepared. Okay, Shirley, so you might feel a little bit of pain when I take up this dressing and tape, okay? But hopefully not too much. So I'm just going to peel up this tape, making sure that the catheter is stabilized so I'm not causing any more discomfort to my patient. Okay, going to hold pressure and pull out the catheter parallel to the skin. Okay, the tip is still intact, so that's good. That's what we want to see. Discard this in the proper receptacle. Okay, sure, I'm just going to apply pressure just to stop any bleeding you may have, okay? And then if there is any bleeding, place in the gauze and squeeze it down for the patient. Okay, perfect. And that is my skill video. Of course, I would clean up the area, take the IV solutions down, and at the end of inserting the catheter, I would document the gauge, the number of attempts, the location, when it was done, when fluids were started, and then now I will document that the removal, the time, the stop time of the fluids, and that the tip was intact, and any characteristics that the IV site may have.